My cat Franny is a 5-year-old house cat, the sweetest little lap cat imaginable, except for a rather serious incident that happened about 6 weeks ago. I've just come home and I was playing with Franny, the little toy mouse, and Franny bit me right on the top of my hand. I washed my hands and then I went to sleep. And I woke up Sunday morning because my hand hurt, so I got some ice and I put that in a towel and I wrapped my hand and went back to sleep. I woke up, my hand just throbbed and ached, and I've Googled cat bite hand hurts, but results make me nervous. So I take a picture of my hand, which is at this point inflamed. I email the picture to my doctor, and then he emailed me back and says, "Go to the emergency room now." So it's been about 12 hours since the cat bite, and I'm at the ER, and they give me some antibiotics. Monday night, I think it's more swollen, and in fact, I think I have a fever. Monday, midnight, I'm back in the ER, and they pretty quickly admit me. They put me on IV medication, and these doctors keep coming in and out and checking on me, and there's, you know, an infectious diseases specialist, and it's pretty scary. Tuesday morning, I wake up, more doctors come into my room, they take a look at my hand, and the swelling hasn't gone down, it's spread. They look at it and tell me that I may need to have surgery. I'm taking it very seriously now. I mean, I'm a writer, I need my hand, the idea that I need surgery is horrifying.
I have to give it up for Molly. That has to be the best documented case of a cat bite and what happened after a cat bite. I mean, that's like textbook.
Now, 80%, up to 80% of cat bites will become infected. Of course, Molly, you know this as well as anyone. So they went in there in surgery, and you said it was basically like wet tissue paper, your tendon?
Yeah. It was an infection called tenosynovitis. Then they had to stitch me back up. I have 2 scars here, and they gave me a soft cast.
And we've seen that a lot, Drew. I mean, when something gets infected and you really can't get to the infection, a lot of times you have to, like, debrief.
Well, and in this case, I mean, that cat bite, and we know the cat fangs are so sharp and long. I mean, it's like injecting bacteria in with a hypodermic needle. And in your case, it was the top part, the extensor surface, and you have a lining to those tendon sheaths. That's what gets inflamed. And if they don't clean that out with surgery, that's what the docs at NYU did for you, you potentially, that infection could have spread to other spaces in your hand, or that infection affected those sheaths so that your tendons actually froze and you couldn't use your hand properly.
And cats have a type of bacteria called Pasteurella in their mouths. So when you combine that with these, essentially, like you said, it's almost like taking a hypodermic needle and injecting it deep underneath the skin. So you had all this done. Very involved treatment, antibiotics in the hospital for a week, surgery. How's your hand doing now?
It's much better. I couldn't open it more than this much at first, but I went to 4 weeks of occupational therapy and did exercises called hand ballet, which is like this, and then flat, and then a claw, and then a fist.
And so, Molly, I think you could probably tell all of our viewers, if you're bitten by your cat, you need to go get attention, get on antibiotics. You know, of course, this leads or begs the question, how's Franny, the cat?
She's well. That's the question everybody asks. They ask, where's the cat now? She's at home. She's a sweet cat, so I'm just a little bit more cautious.
Molly, we're so happy that you're feeling better. Thanks for sharing your story. Now, cat bites, they seem